today in our class we are going to discuss a topic about barium solar procedure. So this is how a barium solar procedure will be done, and the images will be like this only. Okay. So what is the purpose of taking barium solar procedure?
This is a radiological examination to diagnose the upper gastric cancer. This is based on the abdomen of the esophagus, pharynx, stomach. That has two types: double contrast study, double contrast study.
What is single contrast study and what is double contrast study?
Single contrast study is performed for the evaluation of esophageal motility disease. Double contrast study is performed for the evaluation of mucosal disease.
Okay. What are the indications involved in taking a barium solar procedure?
Dysphagia, difficulty in swallow, abdominal pain, and weight loss, hyperthermia.
Okay. So what are the contraindications which is involved in this procedure?
Recently, gastric esophageal surgery, suspected pregnancy, complete obstruction.
Bowel obstruction, and if the patient is suspected of any pregnancy, so this procedure will not yet be done in such cases. Okay. So what are the equipments used for this procedure?
Fluoroscope first about 2 years, and during the single contrast study, take variants double contrast study. The operation is gas position is for double contrast study.
Okay. So how will you prepare a patient for this procedure?
There is no social measurements required. Fasting may be occurs for 4 to 6 hours prior to examination. Instruct the patient not to drink or eat before the examination. Instruct the patient to remove all metallic objects and ask the patient to remove the plastics and change the hospital rooms.
Women should inform about any possibility of pregnancy before entering into the examination. That is also a main preparation. Next, how will you start the procedure?
On the day before the examination, the patient will consider the written consent form to getting the permission for the procedure. The patient is placed in the upright position. The head is flexed on the fluoroscopic screen. The patient is asked to take 10 to 15 ml of barium sulfate and swallow it. The radiologist should instruct the patient to take several amount of barium sulfate, and the radiologist take into the several variation positions like AP, RPO, LPO, anterior posterior, right posterior oblique position, left posterior oblique position. In this contrast study, the right anterior position is best for the tapered examination. Double contrast study. Now, in this double contrast study, the patient is injected on the glucogen agent full of barium sulfate. The patient is asked to take several amount of barium sulfate. After the effervescent powder is given to the patient and asked them to numb the area. It has take various positions like AP, LPO, RPO.
Okay. So how will you perform for double contrast study? What purpose effervescent powder is given? Perform a double contrast study procedure.
After an injection of 1 ml of high density barium sulfate medium, and the patient is asked to swallow the several mouthfuls of barium sulfate medium. During this contrast study, the patient is asked not to burn, and during the procedure. After the subjects, the effervescent powder is given to the patient. Effervescent powder is nothing but a gas producing agent. It is a distended to hold procedure
Until the whole esophageal examination is done. Okay. So for this purpose only effervescent powder will be given. So what is the difference between the single contrast study and double contrast study?
Double contrast study is to view abnormalities of the mucosal details in the esophagus. Single contrast study is abnormalities of the esophagus.
So what is the aftercare which is instituted to the patient after doing the procedure?
Ask the patient to drink plenty of
patient will face after this procedure. So patient might be having slight abdominal pain. Okay. So in case if the patient is, for example, if the patient is coughing or if the patient is voiding to the urine, the fees is when the patient is going for a motion, so the motion will be for whitish, motion will be in whitish color for 2 to 3 days. Okay. So we have to instruct the patient to drink a plenty amount of fluid to avoid all of these things. And complication is nothing that the patient might be having slight abdominal pain due to contrastia. That's all. So this is how Barium swallow images will be visualized. Okay, so nothing but this is the esophagus, and the contrast medium will travel from the esophagus into the mouth, and we can easily visualize if any abnormalities are there in the esophageal wall. So single contrast study is different from double contrast study. So in single contrast study, we can only visualize the esophageal motility alone. For example, if there is any disorder alone, we can identify. But in double contrast study, we can see the mucosal features of the esophageal wall. So how depth abnormality is being intended into the patient's esophagus, that we can easily visualize in double contrast study. So is there any doubt for you? Thank you.